When I was in my training in medical school in Mexico City, I saw a young patient with swelling in the neck, a very huge lump on the neck. He didn't look well at all. So that really caught my attention, and I asked my colleague, what's the situation here? He said, well, that's a typical case of patients with lymphoma who undergo radiation therapy and chemotherapy. You can tell that the quality of life was not good at all. So I said to myself, there must be something else that we should offer to these people where we can improve the quality of life, the survival, that I have to do something more. When I was working in conjunction with Dr. Harold Manner, we received a patient who was only about 4 years old, and he was dealing with a tumor located at the brainstem, which was inoperable due to the high risk of bleeding, and he was under coma. So I said to myself, and I told him as well, we don't have anything that will jeopardize this child's condition. I think we should give him a try. After the second week of therapy, he began opening his eyes and eventually to walk. This child, who was 4 years old, we were able to prolong his life up to 35 years. He was only given 6 months to live. Another experience is my own father developed prostate cancer. It was discovered that his cancer has already spread out into the bones. He was going downhill very bad. I took over and I got him under alternative therapies, and he turned around. We were able to prolong his life to about 7 or 8 years. It was a blessing. And those are situations that really keep you going and to keep up what you are doing.